Welcome to Muscle Research Review for the week of June the 1st, 2015. Quick research summaries for the very busy health and fitness professional. Last week, our topics were primarily focused on rehabilitation. Today, we're going to take an angle slightly towards performance and conditioning. Foam rollers are popular as ever, so it's good to see that there's some research behind it. A new study looked at the effects of foam rolling on hamstring flexibility. The study divided 40 healthy males into a foam rolling, PNF, and control group. There are 12 treatment sessions for each of the treatment groups for about 4 weeks. Results showed greater improvements in hamstring flexibility after the foam rolling and PNF groups, but not the control. The foam rolling and PNF groups were similar in outcome. The study showed that the foam roller can be just as effective as a substitute for PNF stretching. However, another study in 2014 showed that adding foam rolling before static stretching increased passive hip range of motion more so than stretching alone. Now clearly we're seeing some good results. Should be exciting to see more studies coming out with evaluating dose and duration of foam rolling strategies. What factors should you be looking for in your athletes or client once you increase training volume loads? Now, a new study looked at the influence of increasing training volume on exercise performance, physiological, and psychological parameters. They assessed 8 healthy males through 3 weeks of an intervention. Week 1 involved normal training, Week 2 involved an intensified training program, and Week 3 was focused on recovery. Now, the study found that the increased training stresses altered psychological parameters, such as profile of mood states and motivation towards training scores, and endocrine parameters such as reduced resting testosterone concentrations and diminished exercise-induced cortisol responses. Now, however, exercise performance was not correlated with the training stresses. If you're looking to take your athlete's training up a notch, watching for these parameters is important to maintain a balance with performance and fatigue. Want to increase short sprint performance in your young athlete? A new study looked at the influence of strength, sprint training, and strength plus sprint training on short sprint performance in young adults. These 3 groups were compared to a control group. The training groups performed 2 sessions per week for 6 weeks. The strength and sprint groups increased sprint performance. However, there was a larger enhancements with the full squat plus sprint training. For some of you, the results are predictable. For others, the study really stresses combination training as being more superior. Hip and groin pain diagnosis can be broken up into 5 categories: adductor, pubic bone stress injury, hip joint, iliopsoas, and abdominal wall related pathology. Now, a new cross-sectional study looked at the prevalence patterns in an active population. The study looked at 894 patients with chronic hip and groin pain, with 73% being males. They found adductor related pain and pubic bone stress injury rarely occurred in isolation. The hip joint was the most common clinical entity and was more likely to occur in isolation. The hip pathologies can be broken up into femoroacetabular impingement, osteoarthritis, and labral tears. There is a higher percentage of femoroacetabular impingement cases in males and labral tears in women. These results should give us some idea on the direction to go when evaluating hip and groin pathologies in the active and athletic population. If you have any comments, leave them below. Also, make sure you subscribe to our YouTube channel for the latest in muscle research, delivered to you weekly. We'll see you guys in the next time.